Good morning, good evening, good afternoon, or even good night. Thank you so much for joining me today. My name is Tim Harris and I work as Professor of Emergency Medicine at Barts Health. I'd like to tell you a little bit about our Emergency and Resuscitation Masters and Diploma postgraduate degree. So why would you want to study Emergency and Resuscitation Medicine? So many doctors, nurses and paramedics wish to advance their career and develop a focused subspecialty. Examples widely studied in emergency medicine may be toxicology and ultrasound and some of the leadership courses to teach you how to run a department such as an MBA. Well, many of us believe that resuscitation is indeed a subspecialty. It involves a small amount of the patients we see, but those patients are at great risk of suffering, of dying, and having their lives changed. And good quality care can improve their lives, improve mortality. And some of us wish to dedicate a large part of our lives to that group of patients. Now, this degree is open to paramedics, nurses and doctors. We hope that we appeal to doctors from a wide range of specialties: emergency medicine, acute surgery, anaesthesia and intensive care. And that's because resuscitation is an area of medicine that crosses many boundaries. Equally, it's an area of nursing that covers many boundaries. Now, for paramedics, all of you, or nearly all of you, are involved in resuscitation for many of your cases. We hope that we teach you to become good teachers, better clinicians. We hope that we inspire some of you to research, although this is not a research master's, it is a clinical master's. We have a superb faculty in alphabetical order. Ben Bloom, who is an emergency physician and academic with a PhD in brain trauma, and he works at the Royal London. Tessa Davis, who many of you may know not just from her work as a paediatrician at the London, but from the Don't Forget the Bubbles website. Tessa is qualified in both emergency and general paediatrics. Paul Rees works in cardiology in Aberdeen and also is Associate Professor in the Defence Academy of the UK Armed Services. Libby Thomas is an emergency physician from King's and has a PhD in simulation and medical education. Stephen Thomas is Professor of Emergency Medicine in Qatar. He has a long and rich pedigree in research and education and is in the top 2% of rated scientists by Stanford University. He previously ran the Emergency Medicine Resident Programme at Mass General and has an interest in medical statistics. Darryl Woods is an emergency physician based in Queens in East London. He has a PhD based around envenomation and snakebite and trained in South Africa. Chet is dual qualified in maxillofacial surgery and emergency medicine and is an academic and indeed has 2 postgraduate research degrees. We are backed up by a huge and diverse faculty. This faculty is drawn from the UK, Europe, Australia, Canada, America and the Far East. This faculty represents emergency medicine, pre-hospital care, neurosurgery, cardiology, anaesthesia, trauma surgery, civilian practice and military practice. And it's an honour to work with these people. They inspire me and I'm sure they'll inspire you. How do we deliver this package? Well, this is all online and it's delivered over 3 years. Online, so you can work and continue your normal paid employment over 3 years because you work full time, and we want you to get the most out of this study and have time to integrate it into your own work, and so embed the learning into your practice. We offer you 2 to 3 lectures each week, so 2 to 5 lectures each week, and that lecture length will be from 2 to around 5 hours. We supplement these with tutorials, which are on a Thursday, and we have a summer school. Unfortunately, I'm recording this at the time of COVID phase 3, and it looks like summer school won't occur this year, but as we get vaccinated and the pandemic dies away, we're looking forward to involving our summer school again. What's the structure of the course? So in the first year, we start off with an introduction to academic medicine with the fundamentals of research. Here, predominantly, we want you to learn to ask the questions, ask a question, to search for the answers for those questions, and then to critically appraise the papers and form your own conclusions, and then start to think about how you may apply those conclusions into your practice and your assignments for this MSc. We then move on to Module 2, which looks at the pathophysiology of shock syndromes and the tools of resuscitation. Here we discuss basic underlying pathophysiological principles. We talk about fluids, oxygen delivery, and inopressors. In Module 3, we look at cardiac arrest, intubation, ventilation, and analgesia. We also have a brief introduction to critical care paediatrics. Module 4 is emergency care. In this module, we look at all of the medical conditions that can lead to shock and organ failure and how these are affected by shock and organ failure. This is a systems-based module, so we'll look at asthma and COPD, we'll look at respiratory failure, we'll look at cardiac disease, we'll look at endocrine disease, and so on. In Year 2, we focus into more specific areas. We start with the emergency management of severe trauma. Here we study the epidemiology, the pathophysiology, and the treatment of major trauma. In Module 2, we look at diagnostic tools. We look a little bit about venous blood gases, arterial blood gases, and a little on diagnostic imaging, and the focus is on ultrasound. And that's because ultrasound, particularly echocardiography, is fundamental to the diagnosis and treatment of shock. We then move on to Module 7, where we look at toxicology and CBRN, and our last module focuses on pre-hospital care and mass casualty situations. Now, there is an alternative to that last module on pre-hospital, which is emergency paediatrics, which obviously focus on critically unwell children. In Year 3, you're going to move on to a scientific paper, which is a paper that we hope many of you will go on to publish. You will choose the topic, be assigned a tutor, and you'll work on that paper and some supplementary material throughout your Year 3. We believe in a multimodal assessment methodology. Some of you are good at MCQs, some of you are good at speaking, some of you are good at written work, but all of you would like to develop skills in all of these, because wherever you are, wherever you go, you're going to teach. If you're going to teach, it may be at a conference, it may be at a governance day, it may be introducing a guideline, it may be directly to your colleagues. So we're going to help you develop your teaching skills and prepare better PowerPoint or keynote presentations. We're going to help you develop your skills at writing written assignments. We have written assignments throughout the first 2 years, and then for those of you that choose a full MSc, of course, you'll have a mentored process to write a scientific paper. We do use MCQs. These are single best answer format, and of course these are the best way we have just to assess your knowledge and understanding. Queen Mary University London is a proud member of the Russell Group. Russell Group consists of what's widely regarded as the top batch of UK universities. It's a huge university. We have 27,000 students drawn from 160 countries. We've been highly rated in the past for both education and for research. We, the faculty of the MSc, are based in the Blizzard Institute that you can see on this slide. It's a magnificent modern building nestled in the East End of London, and it's unique in that it combines offices, lecture theatres and laboratory space all under one roof. We're of course closely associated with Barts Health, which is arguably the oldest hospital on one site in the world. Barts Health involves the largest trauma centre in Europe. It's home to London's Air Ambulance. We have the largest heart attack centre in Europe with the largest ED under one roof. We were the first medical school in the UK, and we have a rich tradition that we are proud of and proud to continue. So, I thank you very much for your times. You can contact me at t.harris@qmul.ac.uk. Thank you for your time. We hope that we've inspired you to follow your dreams, and hope that one of your dreams is to do this MSc, and you come join us and we help you achieve it. Thank you.